Hey everyone, I'm here today to talk to you about reducing our patients' falls. So, what is a fall exactly? According to the National Database of Nursing Quality Indicators, a fall is defined as an unplanned descent to the floor. With most of the elderly patients, falls occur from losing balance, fear of falling, and weakness. All these contribute to the fact of falling. And I do apologize for my small screen. I'm unable to figure out how to put it up on the big screen today. So, what can we get from this presentation today? So what I want y'all to know is, or want to help with, is to bring awareness and educate the families along with the nurses and staff to decrease the occurrence of patient falls. And also we want to improve our patient outcomes by preventing injuries from these falls. Okay, so here's some facts I want to discuss with y'all. The facts on the falls: up to 7 falls occur per 1,000 patients a day. And with these falls, it depends on many risk factors. Because you know, everybody has underlying factors in their stay while they're here. Also, between 30% and 50% of in-facility falls result in injuries. But these injuries are associated with an increase in the stay, higher and also high rates of discharges from hospitals to long-term care facilities whenever we want the patients to actually go home, not go to a nursing home. Okay, so why do we want to reduce these falls? Falls can cause patients to lose their dignity and also increase their fear of falling. And with increasing the fear of the falling and losing their dignity, it can increases the risk of falls from happening. Oh, excuse me. Okay, sorry about that. Also, nurses will blame themselves after a fall occurs. Nurses will think that techs will think that they're the ones who caused the fall, that they were being incompetent per se, whenever they were doing everything that they usually do. Also, with this, falls can cause an increased workload, such as paperwork, on the nurses themselves. So, what can we do about reducing these falls? So this will be created. It says, can developing a fall safety team to evaluate the recommendations and interventions after a fall in an acute care patient decrease the amount of falls, post-fall complications, and recurrent admission compared to not having a fall safety team. So what is a fall safety team? Well, we'll go ahead and tell you about that. So a fall safety team is comprised of a registered nurse, a physical therapist, occupational therapist, and a certified nursing assistant here in a rehab facility. With all these interdisciplinary people, it will help us determine the facts and determine interventions to help prevent these falls from occurring the next time and the reasons why they fall. So what will this team do? The role of the fall safety team is to evaluate falls, why they occur, would evaluate the falls in the fact of why they occur, where the fall precautions are asking, were the fall precautions in place, and also ways to prevent another fall from occurring. That's just to evaluate the falls. Also, they are in place to educate staff and families on prevention of falls from occurring in the hospital setting and in the home setting. Periodically, whenever they get accruing data, there will be, after a fall occurs, there will be a safety huddles, which will include interventions and recommendations to keep patients safe and prevent another fall from occurring. This can happen after a fall, or it can happen just periodically to evaluate what's been going on and how many falls have been in the last few months. So what do we need to do to start the fall team? So in order to start the fall team, we need approval from administration. In this, we will present statistics such as the facts that I gave you previously and the numbers, and also educate them on the need of an intervention for fall safety. We can pull numbers from the facility and see how many falls we've had in the last few months, but kind of like the last 6 months. Next, we would need to educate the staff on implementing the team and what the team's purpose is. We want the staff to be very involved in the makings of this fall safety team, and that possibly could take approximately 2 to 4 weeks. So next, then we need to create and implement these policies. So with doing this and creating, we need to collaborate between the staff and administration. This could take anywhere between 4 to 6 weeks. That's just approximately. Also, periodically, we need to reevaluate the team and its contributions towards the facility and see if there's any improvement that it needs to be happening. So how will we evaluate the evaluation of the fall team and their contributions to the facility? So what we can do, we can obtain data from the last 6 months of any falls that has occurred. We need to see what the cause of the fall was in an intervention used pre or post fall, and was a team implemented. And we need to make sure that every time a fall happens, the fall team is implemented. We need to have somebody that is not necessarily educated, who is alerted that a fall has occurred when a fall happens. Also, we can perform a electronic or a verbal survey to ask the fill-ins about the new policy and the teams, and if there are any areas of improvement. We always want to improve our patients' outcomes, and we also want to improve ourselves as an individual. Next, and last but not least, this is our goals of the fall safety team. The fall safety team, we definitely want to bring awareness and education to patients, family, and faculty. So in doing this, we want to reduce the patient's fall and complications with the falls. These are our goals for the safety team, as well as we want to decrease the patient's length of stay, because a fall definitely can increase the stay of a patient, and also have less complications and prevent any patient injuries. We want to get them patients home. We don't want them having to stay in a nursing home or go into or stay here any longer and cause any more complications that there already may be happening. But I hope you enjoyed my presentation, and I appreciate your time, and I hope you have a good day. Thank you.